Well, we're welcoming back Lindsay from Friendly Pharmacy 5. Now, we've just talked to Lindsay, the Canadian citizen. We're now talking to Lindsay, the scientist. And I think you wanted to update us on mouthwashes to start off with, Lindsay.
Yes. So in previous interviews with you, John, we've talked about mouthwash in general as being one of our tools in our pandemic toolbox to help prevent or reduce viral load and help prevent severe COVID-19. So the study that we had talked about was out of Brazil, and it's a company, it's a university, the University of São Paulo, that has done research into a product called Fatalox that has now been made into a product produced by a company called Dental Clean. Now, I do not have any interest in this company whatsoever, but
neither do I. Go on.
Yeah. I did report on, we did report on their study, and
you've been talking to their scientists, haven't you?
I've been talking to Dr. Fabiano Vilhena, who's their head researcher, and they did send me some of this. It actually just came a few days ago.
Oh, yeah.
And so I have.
How does it taste?
It tastes nice. It doesn't taste like a typical mouthwash. A typical mouthwash, I think it's the alcohol in it, can just really give you a stinging sensation or that severe minty taste. And
you can show us that, Lindsay, because it's not available in the UK and Canada anyway. So this is you could buy this in Brazil.
Yeah, I think you can, and it's interesting. I mean, thank you, Dental Clean, for sending it to me. But you can see it's clear. It's not like It's very easy to use. It doesn't burn the mouth.
Now let's get this right. You don't drink it. You gargle with it. Is that right?
That's right. That's right. You use it as a rinse and a gargle. And we know that the gargle seems to produce aerosols that can be then taken into the nasopharyngeal cavity. And so they are seeing good results. They're still doing more studies. They have I think about between 6 and 10 studies that are ongoing right now with this product in Brazil. And we know that Brazil has seen very severe cases of COVID-19, very high number of cases and deaths, and that continues. They've also had quite a spike in their cases after Christmas, as did most places in the world. And so the studies that are ongoing, one particular study is in the city of Uru, which is a city of about 1,500 people, where they have given that whole population, and this is before the vaccination program started, because that just recently started in Brazil. They gave the whole population the mouthwash to use, and now what they're doing is they're analyzing whether that city is following the pandemic curve and whether they're seeing the spike in cases as compared to other cities. And it sounds like they are not. I can't say too much. We don't have the data yet. But it's sounding quite promising, and it's sounding that this could certainly be something that is helping to reduce the viral load and reduce severe COVID-19 disease.
So they bash this mouthwash out basically to a whole city?
Yes.
Wow.
And then they're comparing it to neighboring cities to see what the curve is looking like, and comparing it to Brazil in general. So when that data comes out, I will present that data, and Dr. Vilhena is going to come back, and we will speak with him, because it's sounding like it's quite good. And this brings us to the topic of mouthwash in general for prevention of COVID-19. It's not that you don't have to have this product. We know that mouthwash is readily available, and there are some studies, and thank you to many of your viewers who did send me some information on different solutions that could help. And I spoke with Dr. Vilhena, and he said that there is a study out of, I think it's Malaysia, where they used even water as a placebo. And he said that even water, the mechanical lavage that water would provide, it's not a chemical, but the mechanical effect would be more beneficial than using nothing at all, just because you are rinsing the oral cavity. So I looked a little bit at Vietnam. And Vietnam, as we know, is a country that has fared very well in the pandemic. So they have a population of about 96.5 million people, and their total COVID cases are under 2,000. They've only had 35 deaths. 35 deaths to date. It's incredible. And that's for various different reasons. Now, it's interesting. One of the things that they recommended to all of their population was that the population use mouthwash. And the purchases of mouthwash in Vietnam went up, I think it's about 78% during the pandemic.
Really? I didn't know that. Okay.
Mm-hmm. Yeah, you can look that up.
So this is just ordinary mouthwash that you use to...
You can get from
my dentist told me to start using mouthwash about 4 years ago, and I've been using it ever since.
So this is just one of the pandemic tools, public health measures that they take seriously. So on January 23rd, this is 2020, so last year, one of the first COVID-19 patients was treated in Vietnam. So let's just look at that quickly. This patient did not receive any antibiotics. This is a hospitalized patient. This patient, this is interesting. This isn't so much the mouthwash, but John, does this sound like what might have happened in your country? This patient was sent, and I mean in the summer, this patient was sent to the hospital rooftop every morning for sunlight and outdoor exercise.
It does not sound like what is happening in my country, emphatically not.
Nor in mine.
But I think it sounds like a fantastic idea. Now, it's interesting. We've actually had some old sanitaria in this country, sanitariums for tuberculosis. They were instigated in the first half of the century. And the wards had big sliding doors. And I've actually worked in one of these wards. And a huge balcony outside.
Wow.
And I've actually done it when I was about 18, 19, when we had these kind of wards. And you used to put the patients out on a sunny afternoon, and they loved it.
Yes,
and that's what it was for, TB patients, to put them out in the sun. And now we're in some stuffy air conditioning box.
That's right. And the other thing that they did, windows were left open in quarantine hospital room to receive natural air and sunlight and ensure warm indoor temperature to weaken the virus. Patient was also asked to gargle every day with an antiseptic solution, and I think it was multiple times a day. The doctor acknowledged that gargling has not been adopted by the World Health Organization, but doctors in Vietnam decided to do it anyways.
But the point is, I mean, I use mouthwash anyway. I don't normally gargle, but I mean, I do when I remember now, because you've told me to. But this is what you can get in any supermarket. It's a recognized product. It's been on the shelves for 50 years. It's safe as long as you're not stupid and drink bottles of it.
That's right.
And if it was completely useless, what harm has it done? But it sounds like it's far from completely useless. It's a bit like taking vitamin D. It's essentially no risk, but for potentially huge gain.
I agree.
Yeah. So I mean, are you selling more mouthwash in your shop, in your pharmacy department?
Yes. And there's certain types are going faster than others, because the one called Listerine Cool Mint seems to have more data at this point.
I hate the taste of that one. I've tried
in vitro study. I cannot handle Listerine. I think it's really strong. It's really strong. But I think at this point, something is better than nothing. You're starting to get a scratchy throat. Or just have it on hand. And the minute that you start to notice anything, start using this. It's not going to harm you, like you said. As long as you're not drinking it, you're not overusing it in the way that is not made to be used. I think that it's something that could really change the course of people's COVID-19 disease. So
if you go to the supermarket, just buy 2 or 3 different brands. See what one you like the flavor of.
Yep.
And
use it.
There you go. It's So I mean, the science behind this, that this could reduce viral load, makes perfect sense. Now I know it's hard to quantify that in terms of actual quantitative science, but it makes sense that having antiviral chemicals inhaled, or antiviral vapors inhaled, or as you say, very fine aerosolizations. And we've got a long history of this, of course, in medical treatments, as you know. I mean, topical treatments, localized treatments, inhalers, steroid inhalers for asthma come to mind, where you're in it. Ours is called beclomethasone. We call it the brown ones.
Yes.
Is it the same?
Yes, it is.
Yeah, it's good. It's good that it's the same. You just inhale that, and you get this anti-inflammatory corticosteroid type directly in the area that you don't need to absorb it systemically. So this is actually nothing new. This is all sort of variations on existing medical treatments.
Mm-hmm.
So keep us updated on that, Lindsay. But in the meantime, I'm gargling with my mouthwash, so you've got one convert.
Me too. That's good.
Yeah. Now, moving on to something else. I'm not up to speed on this, but there's a very painful condition called gout.
Yes.
And there's an anti-inflammatory that's been developed for gout. Can you tell us what you know about that, Lindsay?
Yes. So there is an anti-inflammatory called colchicine that has been used for decades for gout. So gout happens when we have what's called hyperuricemia, and then the uric acid precipitates out into uric acid crystals that can accumulate in joints. This is known to be one of the most painful things that can happen to a human. Have you ever had gout?
Thankfully
John?
not. I'm hoping not
to.
But yeah. I have looked after many people who have, and they are in absolute agony. And
yes.
If you just lay a blanket on them,
that's right,
and it moves the foot, they just go into paroxysms of pain. It's a terrible condition.
Yeah, these uric acid crystals that build up, they're very needle-like, and so when they get into the joints, it's like there's kind of stabbing into that joint.
The synovial membrane around about the joints is absolutely packed full of these pain receptors, the nociceptors.
Mm-hmm.
So I've looked after some patients recently with dislocated shoulders, and the agony of that, and it's largely due to the stretching of these capsules.
Mm-hmm.
Very painful. Yeah, sorry.
And this causes an inflammatory cascade. And so one of the things that we try to do in gout is we try to reduce that inflammation. And if we can catch it early enough, we can treat it fairly quickly. And one of the medications that we have for that is called colchicine. And colchicine, now we do use other anti-inflammatories as well. Colchicine is an older medication, like I said, that we've used for decades. If you can treat gout early with colchicine, it's highly effective in reducing this inflammatory response. And the reason it's effective is that it diminishes the mobilization of the different white cells that are being mobilized to that area, and it stops them in their tracks, essentially. But colchicine is not without side effects, and one of the biggest issues with colchicine are gastrointestinal side effects, and I think up to 80% of patients do see some gastrointestinal side effects, and diarrhea is one of the most common side effects. So colchicine is effective in gout, and we know that. And at the beginning of the pandemic, we started to notice what we now know as cytokine storm. So the inflammatory response that seems to get a bit out of hand and lands people in hospitals, very hard to reverse once this takes off. And back in March of 2020, this study called the Colcorona study started to look at whether colchicine could be effective at reducing or preventing the cytokine storm in patients. Okay, so this is also an oral treatment. So this is a treatment that can be used in non-hospitalized patients. And
it's just tablets, is it?
It's just tablets, and it can be just taken from home. So they started the study in March, and this was funded by the government of Quebec. This is out of the Montreal Heart Institute. And they looked at 4,488 patients, so it's a large group. These patients were diagnosed, they were either COVID positive by PCR or by clinical criteria, because at the beginning of the pandemic, we did not have access to as widespread testing. So that's a little bit, that it compromises their data a little bit. And patients had to be over 40 years old, and they considered high risk. So they were either diabetic, or they were obese, uncontrolled hypertension, known coronary disease, or fever of at least 38.4 in the last 48 hours.
So high risk for severe COVID?
High risk patients, yes. So what they did is these patients gave authorization to participate in the study, and they were sent home, and the colchicine arrived within, they said, 4 hours of them signing up for the study. So it was on the first day of their diagnosis, because we know this has to start early, okay?
COVID treatments are very time specific, aren't they? The particular timings of various interventions. Yeah.
Yeah.
So this was like on symptom day 1, ideally.
Ideally, it was on the day 1 of diagnosis.
Yes, as soon as they could diagnose. So very much in the viral stage of the illness.
Yes. So what they were looking at is, could colchicine reduce deaths? Could it reduce hospitalizations? And what they found is that they found that there was a 21% decrease in hospitalizations, a 50% decrease in use of ventilation, and a 44% decrease in deaths. Now, I need to make clear that this is a preprint. This has not yet been peer reviewed, and there are some clarifications that we still need from this study. The study did stop, it was terminated a little bit early when they only reached 75%, I think, of their patients that were reporting 30 days after treatment. And they did not look at long-term outcome in patients after 30 days.
Still pretty impressive. Just go through this again, Lindsay, please. 21% reduction in hospital, 50% reduction in ventilation, and was it 20% reduction in deaths?
It's 44% decrease in deaths.
44, wow. I mean, that's... Well, I'm impressed so far, I must say.
They also had a lower incidence of pneumonia, fewer adverse effects, and less rash, even though rash is not quite as common.
Yeah. Interesting, though, right?
It's interesting. I think I'd still like a little bit of clarification on their p-values, because the p-values did not quite approach statistical significance for one of the endpoints.
Yes.
And so I'm waiting for some clarification in that. Now, it's interesting that the number needed to treat was 71, which is fairly high.
However, I'm surprised that it's that high for those percentages.
Yeah, that's why we need the peer review here to have a look at this. The number needed to treat for diabetics was only 29, and the number needed to treat for people over the age of 70 was 31. Now, colchicine is not without side effects, and I already noted the gastrointestinal side effects. There are other side effects as well. I made a quick video on this, a 3-minute video. If you go to my channel, you can have a look at that.
We'll post a link for that.
Yeah, and it also can interact. Colchicine can interact with other medications, like other antibiotics, some heart medications. So it's not something that you would ever take on your own or just take if you can get access to it, if you have some at home. You do need to be followed closely by a physician. I think that this one will have some use. It won't be for everyone, but right now the data is looking pretty good, but still need a little bit of clarification on that one. But it's an old drug, it's cheap, it's readily available, and people could be treated from home. So it's one to keep your eye on.
I like old drugs. We know all about them.
Yeah, that's right.
We know what nasty things they can do, and we can account for it. So that's good. So just to be clear, we think this is working via an anti-inflammatory mechanism, or do we suspect it's working via a potential antiviral mechanism that hasn't been identified yet?
It looks like it's anti-inflammatory. It's preventing the migration of the leukocytes to different areas of the body, and by doing that, and it's preventing what they call inflammasomes, and there's a specific protein that it looks like it inhibits, and I do have it here, but I won't be able to find it in time.
It's okay. It's okay. I mean, basically what's happening is the white cells migrate to an area. The white cells release cytokines that stimulate local inflammatory responses. And the white cells also, if they're damaged, can release chemicals directly, such as digestive enzymes, which are normally contained in the cells and normally useful for digesting bacteria. But if they're released into the tissues, then they can cause an awful lot of inflammation.
Damage.
That's how the lungs are damaged in emphysema. The inflammatory cells release digestive enzymes, and that breaks down the tissue. So again, nothing new. So this is a mechanism. These mechanisms are known about from other areas of study.
Yeah, and I will mention, just because you touched on that there's an experimental model for acute respiratory distress syndrome where colchicine was shown to reduce inflammatory lung injury and respiratory failure by interfering with leukocyte activation and recruitment. So that's part of what they base their hypothesis on here.
That's interesting. So by the time someone's already got acute respiratory distress syndrome, they're already fairly well on into the disease process. So we have very likely efficacy early on in the viral stage, but also potentially some efficacy later on in the second and third week in the inflammatory phase. So one to watch, absolutely one to watch. So there's been no sunshine here at all today, Lindsay. So I've been taking this one's from Asda. I've no financial interest in Asda whatsoever. This is actually the vitamin D that belongs to my dog here. So
oh, that's good that he's taking it. I'm happy for him.
Winston's vitamin D, yeah.
Good, you take good care of Winston. I have mine here as well. It's very dark here as well, and so I have my vitamin D that I'm taking. No financial interest in Jameson.
How much are you taking?
I'm taking 2 a day.
I bumped mine up to 3 or 4.
2,000 units.
Yeah, I bumped mine up a bit because I've actually got a couple of tests that I'm going to get. People have sent me a couple of tests to test out, so I'm going to check that soon. But basically here we just get no natural sunlight at all now for 2-3 months now. You know, it's just
Here too.
Yeah.
Here too. I actually started giving this to my children as well now in the winter, and I found these drops, and I wanted to show your audience these drops because not everyone, sometimes people don't want to take a pill or they find it difficult to swallow, even though the vitamin D tablets that I found are pretty small. So these are just drops, and these are 1,000 units.
Oh, yeah.
And it's just 1 drop on the tongue. And the kids take it no problem. It doesn't taste like anything. But, you know, sometimes if you don't want to take a pill, ask your pharmacist and they might have a different formulation available. There's different formulations that are out there for, you know, each person. So I just wanted to let people know
that's 1,000 units per drop.
Yeah, when I bought it, I actually thought it was only 400 because we have the infant formulation that's usually 400 units per drop. But this one is 1,000 units per drop. So it's brilliant because I don't remember to do this every day for my kids. So we just, every once in a while, here you go.
Yeah, great.
Yeah, so I did look at some vitamin D, a study on vitamin D that I wanted to share with your audience. This is a smaller study. It's only 18 people, but it's looking at vitamin D replacement enhancing what we call antigen-specific immunity in older adults. And I thought this was interesting because when we talk about antigen-specific immunity, we think about, or I start to think about vaccination and how many older people, because of what we call immunosenescence is as the body is aging, our immune system does not respond as well to vaccinations. And so as we start to get older, our body does not seem to be able to target or respond as well to specific antigens like vaccinations. And when I give flu vaccines or any other kind of a vaccine, sometimes people will come back and they say, oh, I didn't feel, many times, oh, I didn't feel anything. It was a great experience. And I'm happy that it wasn't a painful experience, the injection itself. But the response, it concerns me a little bit because I'd like to see your arm get a little bit sore or there to be some kind of discomfort because that shows us that the immune system is responding.
Yes. And
maybe you will have a more effective outcome.
I think so. Yeah, I think so.
So this study, what they did is they used the Varicella Zoster virus. What do you call that? We call that chickenpox.
Yeah, we call it chickenpox. Yep.
Okay.
And it's the same virus that causes shingles.
Yes, that's right.
Yeah. I thought I called it. I get mixed up with herpes zoster. Varicella is just the old name for pocky diseases.
Yes. Yeah. So they used the Varicella zoster virus and they injected a little bit of it under the skin because they've noticed that in older people, as compared to younger people, there seems to be a more general, and I think we would call this the innate immune response in the skin, seems to be more generalized than it is in younger people. So
say that bit again, Lindsay. The immune response in the skin is what?
Yes. So the let me just see if I can actually say that a little bit better for you. So the immune response in the skin of older people as compared to younger people seems to be more of a generalized immune response that is mediated mostly by monocytes as compared to T cells.
It's less specific.
It's less it's less specific.
Got it.
And
yeah.
so they wanted to test whether supplementation with vitamin D could help to make that response more specific to the antigen, because the monocyte response seems to cause just generalized inflammation, and then we lose the T cell response.
And it was more specific. The T cells could actually go after the specific virus that we want rid of. Absolutely.
Yes, and the presence of the monocytes actually can reduce the mobilization even of the T cells, or the ability of the T cells to get to that area.
Right.
From what I've seen. Yeah. So they did 3 separate 3 millimeter punch biopsies of skin, and they used, one was from normal skin of the person. They used the forearm, so they used an area that's usually exposed to the sun. And one of the biopsies they used from saline injected skin, because that can cause somewhat of an inflammatory response. And then another one was from the Varicella Zoster injected skin area. And so, like I said, it's only a study of 18 people. It's only in Caucasians as well. So this study, I think, warrants a larger study to look at different populations, different ethnicities.
So just to summarize, people that have higher levels of vitamin D, they have less of this inflammatory generalized response. So an inflammatory response which probably isn't doing much specifically to get rid of the virus. But when you give them more vitamin D, they get less inflammation, but they get a more specific immune response.
That's right.
And of course, that's exactly what we want in COVID-19. We want less inflammation and more specific antivirus response.
More targeted immune response. So they used adults that had a vitamin D level of less than 75 nanomoles per liter.
Yep.
And they
that's less than 30 in American language, isn't it? That's less than 30.
I don't know, John.
Yeah. No. So that's nanomoles per liter. To convert that into nanograms per mil, you divide it by 2.5.
Oh yes. Okay, that makes sense.
Yeah. No, but sorry, I interrupt. Carry on.
No,
less
that's
than 75.
So they gave 6,400 units of vitamin D daily, orally for 14 weeks. Okay,
wow.
before they did these injections. And then they did the injections and they did the biopsies and they measured the immune response. Okay, so what were the results? The results were that vitamin D supplementation was associated with reduced inflammatory monocyte recruitment in response to saline. Older adults had reduced varicella zoster specific cutaneous immune response. They had an increased non-specific inflammation as compared to young people. Let me see here. And they had an increase in the accumulation of T cells at the site of the varicella zoster virus challenge. Which
of course is what you want. So there was less inflammation. There was more antiviral effect, and there was more T cells. All things we want.
So they concluded that vitamin D3 replacement can boost antigen-specific immunity in older adults with suboptimal vitamin D status. And I wanted to bring this to everyone's attention. I know, John, you have done an amazing, amazing job of bringing vitamin D to the forefront of the pandemic. But anyone who's not taking it yet, we're getting our COVID-19 vaccination soon. And you should really consider it, if not for COVID-19, even just for your vaccination response in future. Some people will not be getting their vaccines for months. There's still time for that vitamin D supplementation to make a difference.
So we're postulating that people with good vitamin D status will get a better immunological response to the COVID-19 jab.
That's correct. And like you said,
I really wish someone was monitoring that and doing a mass test on that, because that would be easy to do, wouldn't it?
Yes.
We could, when people come to vaccination centres, select 1 in 100, do vitamin D levels, follow them up, and you've got your answer. And it's not being done, but it makes perfect sense that vitamin D is going to enhance the immunological reaction to the COVID jab when we get it. And of course, improve the immune response to any bug that happens to float into us in the meantime as well.
There's another benefit.
Everything here about vitamin D is just, everything is confirmational, isn't it? Just appreciate that one, Lindsay. So that's 3 nice pieces of science today. We've had a money's worth today. Not that you get paid.
No, we don't. I don't.
Yeah, so we've had the mouthwash, which I love it because it's so simple and safe. We've had the colchicine, which is an established drug, and doctors know how to use this. And now we've had this further apparent confirmation. Obviously, we need a much larger study, but it's a consistent study on good vitamin D status, enhancing immunological response, and reducing unwanted inflammatory response.
That's right.
And this, of course, is the nature of science. You've given us evidence for these things, which is exactly what we like. I sometimes ramble on my own and start saying things that I don't always have evidence for, but you're very precise with the evidence.
I don't think so, John.
So we appreciate. No, I think you're certainly up to date, Lindsay. So I appreciate that. So great, thank you again. And if you've got some more science, we'd love to have some more at some point. But that's it's all bang up to date research, isn't it? It's exactly what we want.
I'll keep you posted on the mouthwash because it sounds.
Please do. I love that one. Yeah.
Yeah.
This is what the internet should be for. Up to date science, Lindsay. This is what.
Absolutely.
I agree. This is what it's invented for.
Yes, I fully agree,
Lindsay,
John. Thank you.
Yeah. Thanks very much for your time, Lindsay. Fantastic.
Thanks, John.
Great
Take care.
stuff. Thanks. You too.
Bye-bye.
Bye.